Development, Commerce, and Labor Committee. Thank you for the opportunity to provide testimony on House Bill 193. My name is Sherman, and I'm a pediatrician specializing in pediatric infectious diseases. For the last 32 years, I've been director of the Division of Infectious Diseases at Dayton Children's Hospital, where I also function as a hospital epidemiologist and infection control officer. I'm here today, however, on behalf of the nearly 3,000 members of the Ohio chapter of the American Academy of Pediatrics. Our members are committed to keeping Ohio's children healthy and safe. It is for this reason that I'm here to express our concerns with House Bill 193. As you know, this bill would prohibit an employer, including a hospital or healthcare facility, from requiring employees to be immunized against influenza. Proponents of this bill have argued that such employer mandates infringe upon an employee's individual rights. Some complain that influenza vaccine is unsafe and ineffective. They also contend that hospitals only require employees to receive influenza vaccine, since part of the reimbursement is tied to employee influenza immunization rates. These arguments are mistaken. The use of influenza vaccine over many decades has demonstrated both efficacy and safety. Moreover, studies of influenza vaccination among healthcare workers documents enhanced patient safety. A requirement for influenza vaccination of such employees will protect the vulnerable populations that they care for, including young children, pregnant women, the elderly, and those individuals with chronic or immune-compromising medical conditions. All of these patients are at risk for severe, even fatal influenza if they acquire it. Annual vaccination against the circulating influenza viruses remains the best strategy for preventing illness from influenza. According to the Centers for Disease Control and Prevention, influenza vaccination, thankfully, its coverage of healthcare workers has increased over the last 6 years. Importantly, surveys of healthcare workers have revealed that influenza vaccine uptake is highest among those healthcare workers where their employee requires vaccination at 89%. This compares to those employees who only have a recommendation but not a requirement at 69%. And sadly, only 26%, a quarter of healthcare workers receive influenza vaccine with neither a recommendation nor a requirement. The lack of an employee requirement places patients at significant risk in contracting the flu. While there are some good medications to prevent the infection and treat it, immunization remains the sole proven and best method to prevent the flu. Children are particularly at risk for influenza-related complications. According to the Centers for Disease Control and Prevention, as of April of this year, 72 children had died of influenza complications in the United States. Again, importantly, 1/2 of these children are previously healthy with no underlying conditions. Influenza may be especially severe or progressive among children under the age of 2 years. It can be very serious in older individuals, especially those over 65 years of age. Both these young children and elderly individuals are admitted to hospitals with influenza complications at very similar rates each year. Requiring healthcare workers to receive influenza vaccine will augment protection of these at-risk populations. Numerous studies have demonstrated the health benefits afforded to patients with influenza vaccine administered to healthcare workers who care for them, including diminished influenza-related complications and the reduced risk of death. This is why hospital immunization requirements are recommended by the Society for Healthcare Epidemiology of America, the Association of Professionals in Infection Control, the Infectious Disease Society of America, and the CDC's Advisory Committee on Immunization Practices, among others. Further, the Joint Commission requires accredited hospitals and healthcare facilities to improve employee immunization rates in order to sustain their accreditation. Some individuals may point out that influenza vaccine efficacy and effectiveness can be low at times. Influenza vaccines may have some reduced effectiveness during some seasons with the potential for year-to-year variability of the impact of the vaccine. However, CDC interim estimates of the vaccine efficacy during this last season note that overall vaccine effectiveness against influenza A and B viruses was 48%. While influenza vaccine of healthcare workers is important for patient safety, it obviously is important for the employee's own health. Employees who have received influenza vaccine have fewer sick days. Hospital staffing is important especially during the high volume respiratory seasons at the same time the flu is around. Decreased staffing correlates with increased infections. Across all industries nationwide, influenza accounts for an estimated 111 million lost workdays, equating to more than $7 billion in lost productivity. The influenza vaccine can help to reduce these numbers. Employers should have the ability to make decisions that affect the health of their employees as well as the success of their businesses. And if I may, I'd like to comment on our own experience at our institution this past season. We have approximately 2,500 employees in our institution and close to 500 volunteers. We require all of them to receive influenza vaccine in order to work in the institution. We were successful in vaccinating over 98% of these individuals with no serious adverse events. 20 individuals had exemptions, most of those for severe allergic reactions to previous receipt of the flu, and we had to terminate 2 individuals who refused to get the vaccine. In closing, I do understand our concerns over personal freedom that arise from workplace requirements for vaccination. However, patients have the right to safe health care, which includes prevention of hospital-acquired infections. With overall advances in the care of patients with very serious medical conditions, more and more patients than ever are at increased risk for severe influenza complications. One needs the ability to fully protect these fragile lives. Unfortunately, House Bill 193 will remove our ability to do so. Thank you for your time today, and I'll be very happy to answer any questions that you may have.
Representative Ford.
Thank you, Mr. Chair. Whoa!
Sorry. I think I'll go without that. It's really loud. Okay. Thank you, Doctor. Can you?
There are people apparently in an overflow room. Maybe they're not there anymore, I'm not sure.
Is that
How are you doing? Go right ahead.
Could you give us an example of your workplace, like a situation where
maybe in the past, before this advancement in science and medicine developed to get to this point, where maybe there was not an influenza vaccination available, and can you recall like a time, like when this would have been in place, and what the environment would be like then compared to now, and would we be going backward with advancements in science and medicine?
Thank you, Representative Morehead. You mean before we mandated the vaccine?
Yes.
No, we, like all institutions, encourage immunization of our employees, and we probably were close to around 80%. But I had a number of occasions, particularly in our neonatal intensive care unit, where employees would come in, and it's a closed environment. We don't let ill-infected patients in bed with children. But we seem to have documented that some individuals, and it's very well known, would come to work while they're ill, such as the nursing staff. We also know that individuals that have flu for a day before they have symptoms are contagious. So years ago, we had a little outbreak in our neonatal intensive care unit of influenza. And flu in very young infants can be very bad. I mean, that's one of a number of examples that I could give. So, we tried our best, obviously, to protect the children, but that was, back when we didn't mandate it. So not everybody would take the vaccine.
Thank you.
Very good. I do have some questions for you. On the Ohio Nurses Association's position statement on influenza, it says it should be voluntary. That's what they wrote, the Nurses Association. And it leads to another question. If patient safety is considered paramount and ethical regarding influenza vaccination, why are bargaining employees and special class employees treated so differently when it comes to requiring the shot than non-bargaining employees and different class employees?
A little unclear the question, sir.
Well, throughout Ohio, hospitals with bargaining employee unions have been exempted from the requirement, whereas the other employees are required to be at question is, if it's really all about health, why is it we have special classes of employees that can be exempted? And the patients are still under your premise, suffering, or potentially suffering. So is it about the ability to bargain, negotiate, or is it about health?
Chairman Young, it definitely is about health.
Yeah.
And I think that all of our employees that we have, they are our employees. All of our resident physicians are our resident physicians. All of the medical students who rotate through our institution are from our university. We require all of them. We have nobody that we do not require that is an actual employee of our institution. Now, granted, we had a lot of construction in our hospital this year, and we convinced the contracting company that was working to get their employees vaccinated. They didn't all agree it wasn't required, but we try our best. If there are employees, we feel they have to be vaccinated.
Very good. I have another question here. If you consider that the flu vaccine is the most highly compensated for injuries by the National Vaccine Injury Compensation Fund, and it's funded by a 75-cent excise tax on every vaccination that's sold, and that the administering healthcare personnel and vaccine manufacturers are shielded from product liability, how can it be ethical to require employees to get annual influenza vaccination? And the reason I say that is because the employee is then left dealing with the vaccine injury with no other recourse. He has to pay, or she has to pay, for whatever injuries are incurred. They assume all the risk to the employee's benefit. And it's interesting too that in 2011, the U.S. Supreme Court ruled that vaccines are unavoidably unsafe. So,
Yes, I mean,
right.
I always tell individuals that a vaccine is not 100% effective, nor is it 100% safe. But everything that we do in medicine is risk versus benefit. And I think that the benefit of influenza vaccine and all other vaccines has shown time and time to be greater than the risk to the employee. As far as the National Vaccine Compensation Act, that was actually created many decades ago.
There's no correlation. So first question, I had two, Chairman, would be, why is it required on every package insert, every VIS, and on the CD website, it mentions the relationship
To the vaccine.
to Guillain-Barré syndrome and the vaccine?
There is a contraindication to receipt of influenza vaccine if you had Guillain-Barré within 6 weeks of a previous influenza vaccine. Beyond that, it's not a contraindication, it's a precaution. It's not contraindicated. We know that if you had Guillain-Barré before, it can increase the risk of having a second attack. But yet there has never been any documented evidence that the current flu vaccines that we have increase it. It's simply more a precaution to protect the patient.
So that predicates it being on the CD website. Does it state that the only situation is that you've had previous diagnosis of Guillain-Barré?
If you look at the representative, if you look at the contraindications and precautions to receive influenza vaccine, it is considered a precaution, not a contraindication. And it specifically says if you've had Guillain-Barré within 6 weeks of a previous influenza vaccine, that is precaution to receive the vaccine.
I'm concerned you're downplaying it, sir. I have one more.
Go right ahead.
Tell me how the influenza vaccine has been tested for safety in pregnant women and breastfeeding mothers.
It's been administered for decades to pregnant women with no adverse events noted. Now we're talking about the kill influenza vaccine, not the live attenuated vaccine, which is contraindicated. I cannot recite specific studies. I'm sure there are there, but this has been a recommendation for decades. And the reason is that if one looks at influenza on a pregnant mother, if you look at the 2009 epidemic of H1N1 influenza, in a report in the New England Journal in 2010, women in California, there was a far higher predominance of seriously ill mothers who had the flu versus the proportion of women in the United States that were, and in California that were pregnant. More pregnant women had serious disease. So again, it takes me back to the risk versus benefit with the years of experience in the flu vaccine in pregnant women versus the risk of them having influenza with a serious illness to themselves and to the baby.
So your testimony, for the record, is you would know of no adverse events in pregnant women and breastfeeding women? No?
Well,
No.
I'm not saying none, there
You
may
can
be,
say it, please.
well, and I will correct my testimony, there may be some, but I do not know of them. I do not know them.
Thank you, Mr. Chairman.
I would like to see the studies you're citing in reference to such minimal adverse effects and the risk versus reward, if someone's done that type of a study. Okay, thank you. Representative Sheets.
Thank you, Mr. Chairman, and thank you, Doctor, for your testimony. You represent some 3,000 members, is that correct?
Yes, sir, the Ohio Chapter of American Academy of Pediatrics.
Is there a consensus among your thousands of members that vaccinations save lives and protect the public from curable diseases?
Yes, the American Academy of Pediatrics has a position paper that states that, and all of us are members of it.
I hope you can appreciate the passion with which some of the citizens have come here a week or so ago and taken an opposite position. Many contend even at quid pro quo, whatever pro quo, they got a vaccine and something horrible happened. How do you address those issues with those folks that take those decisions?
Thank you, Representative Sheedy. I do not know what their exact complications were, but we do know that, no vaccine is 100% safe. But time and time again, I think we go back to the benefit of immunization versus actually getting the flu. There is and as I said in our own institution, these numbers are not high, but vaccinating 3,000 employees and volunteers, we have no adverse effect other than perhaps some sore arms. On the other hand, if those individuals got flu, we use a training film of one of our volunteers who acquired influenza as a secondary infection with severe Staphylococcus aureus pneumonia, was hospitalized for almost a month and had to go to a nursing home before she came back. So, could the vaccine have prevented her from that? I don't know. It might have. It might have. And I'm not saying that these individuals may not have had adverse events from the vaccine. It happens. But I think, again, looking at the balance between the benefit of vaccine, trying to prevent influenza, and the knowledge that you're going to get the flu, I think it leans towards prevention.
Thank you, Mr. Chairman.
One thing that has, I think, disturbed a number of members of the committee is the whole idea that we have, and we heard testimony from a number of people and have written testimony from others, that they provide the hospital where they're working with their own personal physician statement that they should, under no conditions, get the flu shot. They have autoimmune problems, they have a history of reaction, etc. But the hospital won't buy it. They simply insist on their taking that shot. It's a carte blanche requirement. Everybody gets the shot. If they have a religious objection, they have to either bring their priest or pastor in with them, or they have to have a written statement that in that specific situation, the religion itself requires they're being exempted from the shot. It seems like these one-size-fits-all draconian kind of requirements can really cause harm in specific circumstances. How do you balance that against this idea of universal health and improvement? When you have people out there that are clearly suffering and being damaged by these overarching, all-inclusive requirements.
Sherman Young, I assure you that we do not do that at our institution. I think draconian measures would not be necessary. I have spent probably hours speaking with our employees who refuse to get the vaccine for whatever reasons, and their physicians. And many times we've worked it out. I will give an example. This year we had 5 pregnant mothers that did not want the vaccine, and their obstetrician said they should not get it. Well, that is a high-risk group for vaccination. It's reported, it's recommended by the obstetrics groups to vaccinate pregnant mothers. And so after talking with physicians, the patients, they all got vaccinated. And we did exempt 20 individuals for reasons that we thought were legitimate. We don't have a carte blanche many of those had true allergic reactions, no way I'm ever gonna vaccinate them. So I think to use sort of that cut and dry is wrong. You know, even the 2 employees that we had to terminate, I spent a long time speaking with them and their families. But, you know, they refused to get it. And, you know, if that is draconian, the 2 out of what we did, perhaps it is. But I did spend time trying to rationalize why the vaccine is there, giving them the evidence why it's important to do that.
So you would like the requirement, but then you want us to depend on sort of the goodwill of the hospital or other organization. It might not be a hospital, but it could be any employer in the state, simply requiring all their employees to get the shot, simply trusting their goodwill to administer it in a humane, understanding, and constitutional way.
I think many, if not most, or even all of the position papers from the various organizations do not have this sort of cut and dry, you have to vaccinate. We know there are some contraindications. And I think it's just simple. If I were vaccinating a child with a contraindication, I would not give it to them. There are some individuals that it is not required, but that is a small minority. And I will add, if I could, Chairman, Brown, is that in the institutions such as ours, it's getting a little bit easier to vaccinate our employees because we let them know up front that this is a requirement when they are a new hire. And so if they are against that, then they could choose not to go to the institution.
Representative Watts?
Yes, thank you. Thank you so much for your testimony. I like Representative Young, and I'm real confused on if the vaccination or the vaccination is doesn't prevent the spread of influenza, then why are we forcing it on your employees?
Thank you, Representative West. It does spread. It does prevent the spread of influenza. If it prevents me from getting the flu, then I can't spread it. Now, there is a small group of individuals that may have partial immunity, and if they get the flu, and instead of having a serious disease, they have an attenuated disease. That is a very small number. But most individuals that are vaccinated by far have no symptoms, and they are not contagious.
Okay, and then follow up. If, my understanding, all my knowledge of health, I think most people who practice universal precautions, they prevent the spread of illness, correct? Is that still the focus?
Because that's part of, yes, sir, that's part of the infection control. There are other isolation and infection control measures that one would do depending on the disease that the patient may have, as well as hand hygiene and universal precautions, absolutely.
And then you also testified that 98% is that correct, in the hospital?
Or,
Your staff
yes,
actually has the vaccination and it's working effectively.
well, we hope, yes. We don't, that's a very good question, Representative. We don't follow up. Did you get the flu? And our employee health will know some, but we don't know how many actually were required.
How many years have you been?
We mandated it for 3 years.
It's been in effect for 3 years?
Yes, sir.
Okay. And then of those 98%, of those individuals that did not want to actually get the vaccination, what percentage is that?
It's a little less than 2%.
Just 2%.
A little less than.
So if you made it voluntary at your hospital, you would probably then say 96% of the population would
Well,
actually get the vaccination if you made it voluntary.
Representative, there is the only way that I can answer is we've not surveyed our employees, but national data from the CDC looking at healthcare worker surveys and why they did or did not get the vaccine found that 70% of individuals where there's a recommendation to vaccinate, it's higher if you make a recommendation with a requirement and lower if you make no recommendation. So I would guess that if we, and it is true, when we were doing this prior to the mandate, we were between 70 and 80%, which isn't bad, but it's not 90+%.
So, follow up, if the individual, if the mandate wasn't there, and do you, with your, the hospital continue to try to push the vaccination?
As far as a strong recommendation, yes, sir, we've done that for the 29 years before that I was there. And we look for, best maneuvers to administer it in various shifts, going to where the employees work. Obviously, it's free of charge. And yes, sir, we would obviously continue to recommend it.
Very good. Representative Sherman.
Just one quick question, Chairman. Doctor, I suspect some of the employees, in spite of the fact that as a condition of employment, I agree that I'll comply with being vaccinated. I change my mind for whatever reason I refuse to, and I'm terminated. And I suspect that they're
Encourage better hand hygiene and infection control. So in an attempt to try to diminish the spread potentially of influenza from them. So there are maneuvers that can be done.
Right.
Thank you, Mr. Chairman, thank you. Can you talk a little bit about your experience when people who didn't get vaccines did choose an alternative, like if they choose to wear a mask, or, somebody did get a vaccine and chose to wear a mask, if they were treated differently or ostracized, or if they were treated the same as somebody else?
And our institution is treated the same. However, I do know cases where they have been ostracized. I've seen that in the news and read in the newspapers. We try to encourage that this is what's happening. It's here to protect them and protect their patients.
Yes, just one last question. Do you believe that that this should actually be widespread and actually added to child cares and other healthcare facilities as well as food establishments, or all employers should actually have this type of policy?
Representative West, that's a tricky question. I mean, the current recommendations for flu vaccine in the United States are every individual over 6 months, once a year. It used to be many years ago there were high-risk groups that were targeted. So the current recommendations is anybody by the age of 6 months should get an annual flu vaccine as recommended by the CDC and others. And so I think it would be difficult to require. I do know that in other healthcare settings, particularly long-term care facilities that care for the elderly, there's a big move to make sure that we protect healthcare workers, to protect that elderly population. Daycare centers, I know we already encourage optimal infection control, and we don't require it. We don't find somebody if they're not doing something, and they stop them and tell them they should be doing it, and eventually they can be disciplined. So I'm not sure how it would be. I appreciate what you're saying, but I think that it would be difficult to carry out and to monitor. I think that's part and parcel with the vaccination.
I think, Doctor, I don't want to tie up a lot more time here. Are there any questions from when we get this point? I have here a study from the CDC dated 2013. So you can see why there's so much confusion on the committee. It states that vaccine effectiveness are very low. The findings that there's lower effectiveness for repeated vaccinations over time, and no protection given by the repeated vaccinations in households where it's been repeated over and over again. It doesn't reduce the infections over time. So it seems as if this is my impression, please respond to this. It seems as if basically the whole field is up for grabs. People find something in one study, they find something counter to that in another study. The CDC makes a statement that the spread of the disease isn't slowed down by giving the inoculation, just some of the more profound potential effects. So there's all these different things going on. And it just seems like it's such a strong position to take for an employer to step out there and say, we're going to have to make everybody get this shot. It seems like we need more study, more time, more evaluation before we begin to endorse those kinds of extreme positions.
Thank you for that information, Representative. I want to just make sure that that's the paper that I alluded to, because the paper that I alluded to, when one reads the methods, they looked at 9,000 studies. It's not to come back, it was a meta-analysis to look at it. So this is an area through the decades, there's been a multitude of research and attempt to improve the vaccine. I think that, I always want to make sure that when we tell individuals about vaccine, we're not here to cause harm, or else why would we do the vaccine? It's to help individuals. And I think this vaccine has a long track record with a number of studies that show it is effective. Is it the best vaccine? No, it needs to be improved. But even a vaccine efficacy of 50%, we have 20 million cases of influenza in the United States, we can cut it down by 10 million or so. So I think that, one cannot abandon the utilization of the vaccine. And I think that when looking at all the organizations that have recommended this, the bottom line is that if we protect those caring for our patients, we can hopefully protect our patients.
Of course, I don't think anyone's suggesting we abandon the flu shot. What we're talking about is just not demanding an untried, if you will, although perhaps it's not causing damage to large percentages of people that are administered the shot. We're talking millions of people getting the shot. But still, there's thousands that are being harmed through a process that results in very, very little public welfare good. And according to the CDC, at least in some of these studies, they indicate that it doesn't slow down the spread. It only, again, limits some of the more profound effects in individuals, but they can still spread the disease just as readily.
In a small percentage of individuals, but the vast majority of individuals, in studies about the CDC and recommendations by the World Health Organization and others, it does inhibit disease, it stops the disease. So it is a protective mechanism to minimize the spread of influenza. And you're going to have articles that disagree, but I think in my opinion, the overwhelming amount of evidence supports the use of the vaccine, whether in healthcare workers or others, to minimize the effects.
Well stated, and appreciate your patience with me. Thank you.